Hi, everyone. My name is Jackson. Thanks so much for tuning in for this presentation. My colleague Jason and I are here to present on how we're seeing communities promote equity across the planning, implementation, and evaluation of civilian-led crisis response programs. And the Vera Institute of Justice is a national research, policy, and advocacy organization that works across the criminal, legal, and immigration systems. Jason and I are part of the Redefining Public Safety Initiative at Vera, which is broadly focused on advancing new approaches to community safety and evidence-based alternatives to end over-reliance on policing and reduce racial disparities. And this work includes supporting civilian crisis response advocacy and program development alongside stakeholders in New Orleans, where Vera has an office, as well as in Cleveland. And we'll talk a little bit about that work later. Next slide. So a lot of what we're sharing today is based on a resource we published last year, our Civilian Crisis Response Toolkit. The toolkit includes recommendations across planning, implementation, and evaluation to promote equity and anti-racism. And for background, Race Forward defines racial equity as a process of eliminating racial disparities and improving outcomes for everyone. So process is an important part of the definition, not just outcomes. They explain that racial equity is both the intentional and continual practice of changing policies, practices, systems, and structures by prioritizing measurable change in the lives of people of color. So with that in mind, after a brief overview of the toolkit, we hope to build on the research that resulted in that toolkit by spotlighting more recent examples of how we're seeing communities promote racial equity in their work. These examples involve program planning and community collaboration, using data to guide implementation, and ongoing community oversight for a community-driven program. This presentation will also include a few links, and you should be able to click through and access those web pages through the slides available on the conference website. So next slide. So this is the online toolkit we released last year, Civilian Crisis Response, a toolkit for equitable alternatives to the police. And the toolkit has a focus on anti-racism and equity because we know that policing has disproportionately harmed Black communities and other communities of color. And we know it's also critical to consider how the policies and practices of other systems, such as behavioral health, have also contributed to inequities that impact people's access to appropriate and timely care. Next slide. Our goal with the toolkit was to highlight not just why communities should prioritize equity, but also the how. And the toolkit includes strategies, lessons learned, and promising practices that we compiled from interviews with program leaders, with advocates, researchers, and equity experts across the country. And here I've also listed a few examples of the programs and places we spotlighted in the toolkit. Next slide. So here's the outline, the different topics we cover across the toolkit, and you'll see the areas in bold and underlines that we plan to spotlight here with this presentation, offering a few more recent examples we've seen since the publication of the toolkit. Next slide, please. So local programs need to be shaped by the perspectives and recommendations of community members that come through in the planning process. And it's especially important to hear from people who have that direct lived experience of current services and responses, people who've experienced crises themselves, and Black, Indigenous, and other people of color that have been disproportionately harmed by policing. And without these perspectives, programs risk perpetuating distrust and reproducing the inequities of status quo approaches. Next slide. Since we published our toolkit last spring, we've seen a lot more programs take shape, and all these additional programs give advocates more examples they can point to and learn from as they continue to push for more unarmed responses in their communities. For communities that haven't yet launched these programs, it's especially important for public safety and health partners to continue hearing from directly impacted community members so they can effectively build out a layered approach that includes civilian-only teams. Given the number of programs we're seeing, we also see a variety in terms of how they're staffed, the specific kinds of calls they handle, and other key program elements. Equitable, inclusive planning can help ensure that new programs include the program elements that directly impacted community members prioritized most. And additionally, advocates can help local public safety partners identify similarly situated communities that are successfully modeling unarmed responses to crisis situations. So just to share an example, in Cleveland, which already has an expanding co-response program, advocacy partners have elevated unarmed responses as that other key element of the community's approach to crisis situations, and the next place they really need to go to make those responses as impactful and appropriate as possible. And these partners have included community members with lived experience from the Northeast Ohio Coalition for the Homeless, Magnolia Clubhouse, and REACH, a more recently established grassroots coalition that aims to advance what they refer to as care response, both in Cleveland and across Northeast Ohio. Part of this work has included planning and facilitating cross-site learning conversations with existing programs in St. Petersburg, Florida, and Cincinnati, Ohio, which has helped show stakeholders across the city how these programs are able to operate successfully in other places. And these efforts have ultimately helped to promote buy-in, and Cleveland recently onboarded a new senior strategist for public safety and health who can help move this work forward. Next slide.
All right, awesome. Thanks, Jackson. So in addition to learning from other places and programs, I just wanted to share another example from Cleveland, which is complementing their efforts to develop an unarmed civilian crisis response program or care response. And again, the idea here is to do consultation and surveying with community members who are directly impacted to make sure that a new civilian crisis response reflects their perspectives and desires for a new program. So starting in the summer of 2022, Policy Matters, REACH, and their local partners began a community surveying effort. Here you'll see from them the goals and value of doing this community surveying. So asking those most impacted and who are most likely to need and to use the new civilian crisis response program, and asking them about their experiences, perspectives, and hopes. So a few good practices from their community surveying process. Firstly, the idea of asking those most impacted. So their first wave and phase of surveying was in partnership with the Northeast Ohio Coalition for the Homeless, or NEOC. And over the summer of 2022, members of NEOC's Homeless Congress, which is a group of community members, advocates, and local leaders with lived experience of homelessness, actually did the interviewing. And they interviewed 177 community members, many of which who were currently experiencing homelessness and housing insecurity, or had previous experience of homelessness and housing insecurity. The coalition in Cleveland actually modeled this community surveying approach after what Portland Street Response and Street Roots did a couple of years ago to start the Portland Street Response program. So again, example of a lesson from another place, but making it grounded in the local experience for Cleveland here. And again, people experiencing homelessness are just one of many groups that can really benefit from the new crisis response program. By doing this survey, they were able to reach folks who had previous interactions with the current co-response and other first response options, and so to be able to ask them about what they think about a new civilian crisis response programs, and also people who sort of have health and social needs in the community. So Cleveland is planning to work with other groups and partners to make sure that a number of other different populations and groups are included in this type of community surveying and the program planning work. And again, just the idea of understanding the experiences, perspectives, and hopes of local community members to inform program planning. Some of the questions that were asked in these community surveys, again, inspired by and adapted from Portland Street Response and Street Roots. What are the preferences that people have for responders, training and skills? What training, skills, and experience would they like people to have when they are responding to people in crisis? And what types of services and supplies would they like the new crisis response program to be able to provide? So again, these are very helpful and locally grounded pieces of information that can support and complement program planning efforts going forward.
So as Jason shared, surveying community members about what they want from a crisis response program is a really valuable way to use data during the planning phase of program development. Tracking data and using that data to make decisions continues to be critical as a program rolls out. For example, as we explain in our toolkit a bit more, programs should be tracking key performance metrics to evaluate for equity, collecting feedback from a wide range of stakeholders, and sharing data and evaluation updates with operational and community stakeholders on an ongoing basis. Next slide. So what this looks like concretely, one way we're increasingly seeing programs regularly share data is data dashboards. And dashboards are valuable for a number of reasons. Broadly, they can centralize multiple streams of information in a single place. They can also help to tell a story about the work that civilian crisis response programs are actually doing. Well-designed dashboards present data accessibly so that even people who do not see themselves as data savvy or data people can learn from them. And public-facing data dashboards help promote transparency and, by extension, accountability. Key information, including client demographics and where teams are responding to calls, can help people track how equitably a program is being implemented. And with this in mind, these kinds of data sharing tools can also equip community advisory bodies to provide feedback that is informed by this data in addition to their lived experience. And I'll say more about community advisory boards later. Internally, so among operational stakeholders such as 911 staff, program leaders, frontline responders, dashboards can help support day-to-day operational decision-making by illuminating challenges and opportunities reflected in the data. For example, days or times or places in the community where demand for a program exceeds a program's capacity to respond. And programs like Durham, North Carolina's HEART, and Cincinnati, Ohio's ARC are using dashboards to share information in exactly this way. So, for example, you'll see here a snapshot from the Durham dashboard. Here you have responses broken down by client demographics, and we also have a snapshot from the Cincinnati dashboard where we're able to get a sense of the different neighborhoods receiving ARC responses and the different types of situations that the team is covering. Next slide.
Right, thanks, Jackson. So as just another tool and a way to complement having one of these real-time data dashboards, we're also seeing, it's really great to see programs that are investing in evaluations at different stages of their program. So again, this can be important to plan for and focus on evaluation with a focus on equity to make sure that programs can adapt and improve through the course of early pilot phases and then on to later implementation and expansion. Evaluations can draw on a range of data sources to identify potential disparities and inequities in how clients are accessing the program and outcomes. Data sources can include quantitative data, like you saw on the dashboards, also qualitative data from clients, as well as program and system stakeholders, as well as protocols and practices such as the dispatch and response protocols, hiring and training materials. So these can help tell a story about the overall program implementation, the experience of trying to coordinate and have a new program amongst existing services and supports, and also that experience from the start of calling for help and the 911 dispatch experience through to the team responding to someone in crisis, and then as well as the follow-up experience. So here I just wanted to highlight a recent evaluation that St. Petersburg, Florida's CALL program has published. They worked with a team of researchers from the University of South Florida. And again, it has a focus on the processes of program implementation and a focus on equity. So they wanted to understand were any of the program protocols and practices vulnerable to implicit bias or any ways that it might be inadvertently contributing to barriers to more equitable access to the program. And then based on a range of data, was the program equitably reaching all community members and in the different neighborhoods that would benefit from the new CALL program? There's a lot in this report, we'll include in the link, but just a few examples of the value of doing these types of evaluations. They were able to review the 911 protocols and appeared to be clear and helpful for the dispatchers to learn how to dispatch to the new CALL program. Since CALL has been implemented, they've they've observed that call is reaching mental health and alcohol or drug-related calls, which is one of the original intents of the program, which is great. One area of improvement that the evaluation revealed was based on the neighborhoods and zip codes. So they're able to identify that zip codes with either more Black residents or the zip codes that were more economically disadvantaged were actually less likely to receive a follow-up contact than other zip codes. So again, this is sort of a good piece of data that can inform how the program addresses that gap going forward. This might be representative of, potentially folks who are experiencing more economic insecurity are harder to reach for the team. And it also might speak to whether clients, communities of color and Black community members are less receptive to, this new response, and maybe some areas where the team can improve how they are relating to clients. So again, this is just one example. There's more, a lot from St. Petersburg here, and there's other examples from other programs in the country, but just encourage, and it's great to see programs that are taking this comprehensive and thoughtful approach to evaluating equity in their program and using that to inform program improvement and adaptation. All right, so the last topic we're going to cover is ongoing community oversight. And this relates to the idea that, a lot of programs are maturing. So something that is exciting and important to sustain and scale programs is to ensure that programs continue to be informed by and are accountable to directly impacted community members. So we want to share some of the mechanisms for ongoing feedback and accountability. A few recommendations for any oversight or advisory processes are ensuring that there are concrete ways for the community advisory or oversight or stakeholder group to provide feedback. So there should be clarity around the types of feedback that's being asked and how decisions and who's making those decisions, right? Ideally, any key decisions about program changes, program expansion are being done in consultation with the community advisory or oversight or stakeholder group. Community advisory and oversight groups should also have the resources and support necessary to effectively share feedback and input. So for example, these groups should have access to all the available program data that is being tracked. And lastly, community advisory and oversight groups should be intentional in their composition and representation, should be representative of the community members who are served by the local program.
Thanks, Jason. So I've been fortunate to have the opportunity to work with partners at the New Orleans Health Department on the city's new Mobile Crisis Intervention Unit, or MCIU. And broadly, our partnership has involved providing technical assistance and sharing resources, lessons from the field, to support planning around community collaboration, data sharing, and using data to guide how the program is implemented. The program is developed in partnership with Resources for Human Development, the contracted service provider, as well as other health and safety stakeholders across New Orleans. And the service is responsive to community demands for more timely and appropriate responses for community members with urgent behavioral health needs. Those demands came from groups like the Orleans Parish Prison Reform Coalition, whose former executive director also served on the City Council's Crisis Intervention Strategy Task Force, established in 2021 to study new response strategies. So now, as of June 2023, MCIU is rolling out in New Orleans as a 24/7 citywide service. And the health department will soon convene a community advisory board that helps promote ongoing community oversight and collaboration alongside operational stakeholders. The ultimate goal being to ensure that program activities reflect the insights of directly impacted community members so they can meet their needs. And meeting topics will include programmatic updates such as 911 call screening methods, staff hiring and training, and collaboration with other agencies, as well as community education, coordination with other community-based services, and data transparency and strategy. And the advisory board has really been designed to facilitate access to relevant program stakeholders, as well as relevant data that helps advisory board members understand whether MCIU activities are achieving their goals. So I look forward to sharing more information about this work once the group starts meeting, but for now, the city is seeking applications for membership from community members, and particularly those who have lived experience as a behavioral healthcare consumer, family member, or other caregiver. The idea being to convene a board that reflects the community served by the program. So with that, just want to thank you again for tuning in for our presentation. We encourage you to visit Vera's website to review our toolkit for more examples, and please feel free to reach out to either one of us with any questions. We also always welcome the opportunity to connect and hear from local advocates and programs about how they're promoting equity in their work. So thank you again.
Safety and justice go hand in hand. We actually can't have one without the other. On the ground, every day in over 40 states, our staff work with community partners and government leaders to actually show here's how you make communities both more safe and just.
We've long been told that police and prosecutors and prisons are the things that will keep us safe, but what the evidence shows and what we know is that what keeps communities safe and healthy and thriving is systems of care and of healing and robust civic infrastructure.
Equity is safety. You start to see true safety when people have their needs met and have the ability to contribute. Giving people access to the skills and tools that they need to be successful is a way that we can get to safety.
Diversion is safety. The system that we've built has not served us, putting people in situations where they are unable to serve their communities, they are unable to be safe in their communities, and they are unable to grow as human beings. We need to change that.
Centering community is safety. Traditionally, prosecutors have had a pretty small palette of tools to work on increasing public safety. Charging folks, stamping folks with convictions, and pretrial detention and incarceration. We know those tools exact huge tolls on communities. So we're encouraging prosecutors to focus on finding a way to keep criminal cases out of the system and move them to community-based solutions.
Opportunity is safety. One of the things that's most central about our work is really acknowledging that public safety and policing are not the same thing. What my team works on is helping places build out more of a civilian public safety ecosystem and trying to understand what people need to thrive and then trying to meet them where they're at.
Flourishing community is safety. Now that we've passed bail reform and thousands more New Yorkers are not languishing in our jails pre-trial, what can our state do to invest in those folks and implement public safety supports that aren't merely law enforcement? Mental health treatment, substance use treatment, affordable housing to make sure that people are getting just outcomes and then making sure folks do not end up back in our criminal legal system.
Love is safety. When I envision safe communities, I see barbecues, fresh food at supermarkets, jobs, colorful murals. I see children on jump ropes and communities that feel lived in and loved.
Justice is safety. Most of all, safety looks like not more punishment, but true accountability in response to people's needs and making communities thrive. That's what safety looks like, and that's what justice looks like too.